combination of some of the old stuff and some new stuff. Dixie's here with me, so hopefully we can get through it without her attacking me on the floor. So start by laying down on your back. You know we're going to start off with some breathing, even though I know you don't like it, but it really is the foundation that sets the position of our ribs and our pelvis, which ultimately determines how the rest of our body moves. So knees bent, feet on the floor, hand on your chest, hand on your stomach. Let's just take a couple normal breaths into the belly before we start to change anything. All right, I want you to put your hands on your hips, and I'll pull my shirt up here so you can see if you need a visual. We're going to go extreme. We call this anterior tilt, where we create this kind of gap in our lower back, kind of tilting our pelvis forward. And then we're going to go extreme posterior tilt, where our butt almost comes off the floor, but it doesn't. We're just pushing down really hard. And then we're going to find somewhere in the middle, and that is where you're going to stay, that neutral pelvis position. And then we're going to tighten up the stomach. So we can tighten up the stomach like this without going into this excessive posterior tilt. And that's what I want you to work on right now. So major anterior, major posterior, like really tucking under, but then find neutral and then brace the ribs down, right? There's a big difference between pulling the ribs down and tilting the pelvis. Chill, honey. Tilting the pelvis to create this smush. Okay. Then once you find that neutral position, now start to breathe. Big, deep belly breaths. Breathe into your belly. Start to feel more air into your lungs. And then we're going to stand up. Hopefully she stops barking. We might be on and off the floor a lot this round. Alright, so same concept, right? Really big anterior tilt, really big posterior tilt. Somewhere in the middle, bring the rib cage down, and now breathe in and out. Put the hands on the outside of the rib cage here and really try to expand without anteriorly tilting, without posteriorly tilting, keeping this neutral pelvis, keeping this neutral rib cage. Two more really deep breaths, as much air that you can fill into your lungs, starting from the bottom and then working your way up. All right, we're going to do a little bit of segmental spinal rolling. So tuck your chin and try to curve around your upper neck as much as you can. When you can't do that anymore, start to round through your thoracic spine. Rounding the shoulders kind of helps that. There's a lot of movement from the upper neck to the upper back, not so much into the lower back quite yet, but then we roll all the way down. And then I want you to grab something while you're down here, either your toes, your feet, your shins, your ankles, and then I want you to create a little bit of traction and round your back as much as you can. It's like you're pulling away from your legs. Almost feels like you're trying to push your spine out of your skin, and I want you to take a really big, deep breath in. And then exhale, relax your hands, and then just kind of fall down into this forward fold. Okay, kind of getting into a little bit of yoga here. So we're going to inhale, halfway lift, flat back, a little bit of an anterior tilt here in the spine. Pull the shoulders back, lift your chest. Exhale, round. Grab the ankles traction the spine, and inhale. So the shoulder blades are coming away from the spine. You can soften your knees, tuck the chin, round your back as much as you can. Pull, inhale, fill the lungs, expand the rib cage. Exhale, let it go, release your ankles, fold down, and roll it all the way up. Inhale, reach the arms up. Right hand grabs the left wrist. Let's take a side bend over to the right. Side bend over to the left. Separate your feet about shoulder distance. Hinge, so soften your knees a little bit. We want to make sure we turn these knees out. Hips back, not a lot of knee bend here. Okay, so we're going for like a hamstring stretch. Hinge. When you cannot hinge anymore, grab the ankles, drop the hips, deep squat, look up, and then I want you to kind of shift side to side to work into those ankles a little bit. Use your elbows to push the knees apart, and then relax, and then come back together. Okay, lift your chest, lift your hands, and stand up. One more time, hinge. Grab the ankles, drop the booty, wiggle around. This time, bring your hands to prayer. Elbows on the inside of the knees, look up. I want you to squeeze your thighs together into your elbows, contracting the inner groin. And now use the outer hip muscles to pull the knees away from your arms. So I'll repeat this again, facing you. Drive the knees into the elbows, squeeze the inner thigh, tighten up, and then use the outer hips to pull the knees away from the elbows. And stand. All right, so we got our breathing warmed up, our hip hinge warmed up. Let's take it down to the floor. Cat cow. Here she comes. Here she comes. All right, take it all the way down to your belly. We're going to go into that Sphinx pose where the elbows are down underneath our shoulders, palms are down. So the last time you were here, we talked about how Cobra is challenging for you. So the first time you go into Cobra, transitioning from Sphinx might help you because it forces you to put your hands farther forward. So look forward, draw the shoulder blades away from your ears so we get activation between the shoulder blades, look up, and now extend the elbows. We get a little bit more pressure to the lower back, and then lower, drop the elbows down. Let's take the hands a little bit wider away from each other. Again, lift the elbows, look up, look over your right shoulder, look over your left shoulder, kiss your puppy, hi honey girl, and down. Now I want you to slide the hands back like 4 inches and repeat. Lift up. And down. So as you do this, just keep sliding back, maybe like an inch or 2 at a time, and just kind of see how your body is reacting and how it's changing to these exercises. And then you're going to find a point where you feel stuck like you initially showed me, and that's where you're going to stop. Let's sit it back into a child's pose. Take the arms, reach them forward. Take your hands over to the right and really reach from those left fingertips all the way to your hips. And then take it over to the left. Back to the center. Now we're going to come into a modified half plank. So we started that chaturanga sequence on the bar, but we're going to be on our knees, and I just want you to work on that protraction, retraction here. So it's different than tabletop. Okay, tabletop, knees are under the hips. We're going to back those knees up so that we're more in a plank here on our knees. And we're going to go 10 reps, protraction, retraction, without sinking our hips down or without shrugging the shoulders up to our ears. 3 more. On this last one, I want you to hold the protraction, lift your knees into a high plank, and then lift the hips back into a downward facing dog. Okay, so we got a little mini flow here. We got downward facing dog, high plank with protraction, drop the knees, shoulder or scapular retraction. That's it. Protraction, high plank, downward facing dog. 2 more. High plank, drop the knees, scapular retraction, protraction, downward facing dog. High plank, lower the knees, retraction, protraction, high plank, downward facing dog. Bring it back to high plank. Take it into a left side plank. So you can stack the feet, you can scissor the feet, but we're gonna go left side plank on your hand. And really think about not just the left side of your core working, but it's a lot of the left hip here, trying to keep that hip away from the floor. I hope you're still holding it. Back to high plank. And then other side, right side plank. Again, keep the hip lifted, not just using the obliques, but the right hip muscle. And back to high plank. Walk your hands back to your feet. You're crazy. You're a crazy doggy. Okay, in the second video, we did a lot of shoulder stuff in a hinge position, but we kept the repetitions really low. We're gonna bump it up to about 10. So we're really gonna challenge, 1, the shoulder strength and endurance, the ability to maintain the weight in your hips, and then also the stabilization of your core and your spine. So feet are gonna be about hip distance, soft bend in your knees, hinge so your trunk is about parallel. And we're gonna start with 10 T's. So we're gonna go palms forward, thumbs up, out to the side squeeze for 10, 9, 5, 4, 3, 2, 1. Hold it up. I want you to do little pulses here, like 1-inch movement for 10, 9, 8, 7, 6, 5, no! 4, 3, 2, sorry about that, 1. Bring it up. Inhale, reach the arms up. Exhale, keep the arms lifted and pull the rib cage down. Okay, flat stomach, no flaring of the rib cage, 6-pack abs as we reach the arms up. Release and come back into your hinge. We got Y's, thumbs up and down in that Y position for 10, 9, slow intentional. Activate your butt muscles, lengthen your spine. 8, 7, 6, 5, 4, 3, 2, last one, hold it up, little pulses here, 10, 9, 8, 7, turn on your butt, pull your rib cage down, 5, 4, 3, 2, 1, take a break, bring it up. Inhale, reach the arms up, right fingertips, grab the left wrist, side bend right, side bend left. Release the hands behind your back, interlace your fingertips, squeeze, draw the shoulders down, stand tall, lift your chin, and I want you to think about shoulder external rotation. So we can still be bound back here, but our shoulders can be forward and internal rotation. I want you to try to increase the length across your chest. Push your chest out without popping your rib cage, and really make that movement come from your shoulders. All right, release into your hinge again. We got 2 more here. Okay, Hands down towards the floor. First thing you're gonna do is row, so your elbows are out to the side. And then turn your thumbs forward, so palms are facing each other. We got shoulder external rotation in this hinge. So rotate from the shoulder, hands come up, thumbs towards the ceiling, and then back down, fingertips towards the floor. So fingertips towards the wall in front of you, external rotation. We're activating the back of the shoulder, and then release fingertips towards the floor. 8 more. 7. There's a lot going on here, okay? We're driving our knees away from each other. We're in a hip hinge. We have a neutral pelvis position or slight anterior tilt. Our core is engaged, rib cage down. Our neck is in neutral alignment. We're retracting our shoulder blades, keeping the elbows lifted and externally rotating from our shoulder. People want to go to the gym and dick around and just talk and listen to music, and then that's why they're a disaster. Let's go 4 more. 3, we're not going to pause this one. 2, 1, bring it up. Whew. My right shoulder really feels that one. Okay, 1 more in this hinge position. Shake it out. Sleepy baby. All right, back to your hinge. We're gonna take those arms reaching forward like we're gonna do the Y, but now we got a pull and a push. So think about lat pull down, elbows to the rib cage, shoulder press, push it forward. It's simple, just keep all the other concepts tight and aware. Pull, push without lifting up. 7 more. 6, 5, 4, 3, 2, 1, and release. All right, we're gonna keep this one short and sweet. That was a lot more endurance, muscle activation to your posterior chain than any of the other videos. So you do some stretching, walking. Sorry, this one's late, but if you don't get a chance to do it, no worries, you have it for this week. See you tomorrow.